It would be great if the person taking care of your children knew what to do in an emergency. It would be nice if they came to your house knowing how to change a diaper, how to feed, how to make dinner, versus having to show them or assume that they know it, and that dinner is well balanced and is the right thing to do. One of the key things you want to determine when someone's going to be the babysitter, especially a younger person, is are they mature enough to be a babysitter? Do they understand the responsibility of the role? If they've taken the time to take a detailed training program that covers all the things they have to know, as well as from an organization that anyone will recognize like the American Red Cross, it tells a parent this child has done something to take on that role. I'm mature, I'm responsible, I understand that. The babysitting course taught by the American Red Cross covers several different areas. One of the areas that people think of but probably will be used hopefully the least is the emergency. What to do when things happen. What to do if someone chokes, if they have a breathing emergency, if a child has a fever. But the other things that are taught are probably the things that are used more often and equally as important. You're now in a house with children of all ages. So what do you need to do for a 1-year-old versus a 5-year-old versus an adolescent? What do you need to do to make dinner? If you have a baby, to change a baby. How do you feed a baby versus a 3-year-old versus a 10-year-old? And the last part is, what are those things you have to do? Because babysitting is a job. So what are the things you want to know before you go to someone else's house to babysit? What are the conditions you want to have? You want to make sure that you as the babysitter, or your child who's going to be a babysitter, knows what to expect from the family that they're working for, and they know what to expect from the babysitter. So it's sort of kind of 3 domains that are very important. What to do in emergencies, the things around how to take care of a child, child development, and the basic skills you'll need, such as feeding, changing diapers, formula, preparing dinners, and the other picture of it is employment, and for many people it may be their first employment. So what are the things around that you have to consider? The American Red Cross is an excellent resource to use for babysitting as well as other training. If you think about the things that a babysitter needs to do, these are things that the Red Cross has been studying, teaching, and developing for over 100 years. What to do in an emergency? Well, who better to turn to the American Red Cross to be trained about that? What to do for caregiving? And at the end of the day, babysitting is a type of caregiving like the other caregiving trainings we do as the American Red Cross. How to interact with the community, how to take on a job and a role. These are things that the American Red Cross has been teaching the public in the United States for over 100 years. So drawing upon all that expertise and resources, the babysitter not only gets something that has the best information, but the other thing is when your child takes a course in babysitting, it's supposed to help them get the job as a babysitter. And there's a recognition that an American Red Cross training has that no one else can provide. So not only do they get the expertise from the American Red Cross, they go out and be able to tell people, I have a training that anyone will immediately recognize as a quality program.